The amount of blood supplied to a given mass of tissue in a given period of time is called perfusion. Among other things, the blood brings nutrients, hormones, antibodies, and oxygen to the tissues and removes waste products from the tissues. These waste products are called metabolites. Our bodies control perfusion by altering blood pressure and blood flow via vasoreflexes, which are quick and powerful mechanisms. There are three ways of controlling vasomotor activity: local, neural, and hormonal. First, let's take a look at local control. If a tissue isn't getting enough blood, it won't get enough oxygen and it will become hypoxic. Also, its metabolites will begin to accumulate. These factors will stimulate arterial blood vessels to increase in diameter. This is called vasodilation, and it increases blood flow. As the bloodstream delivers the needed oxygen and carries away the waste, the vessels will reconstrict. A homeostatic dynamic equilibrium is established that adjusts perfusion to the tissue's metabolic needs. In addition, trauma, exercise, or inflammation can cause the cells and tissues of the blood and blood vessels to release vasoactive chemicals like histamine, bradykinin, and prostaglandins. These chemicals also stimulate vasodilation. If a tissue's blood supply is cut off for a period of time and then restored, it often exhibits reactive hyperemia. This is an increase that exceeds the normal level of blood flow, and it may be due to the accumulation of metabolites during a period of ischemia. An example is when the skin of the forearm gets flushed red after a blood pressure cuff has been removed. Over a longer period of time, a hypoxic tissue can increase its own perfusion by growing new blood vessels. We call this angiogenesis. It happens in the uterine lining after each menstrual period, the development of a higher density of blood capillaries in the muscles of well-conditioned athletes, and the growth of arterial bypasses around obstructions in the coronary circulation of the heart.